Good morning to you. Tell us how things are going there.
Well, following those running battles in which we have seen over the past couple of days, we know that one thing that has been hampered is, of course, the vaccination process for especially Gauteng and looking at KwaZulu-Natal. Well, today we can see that the Ministers for Social Development as well as the Acting Minister for Health, Mmamoloko Kubayi, they are here in Tembisa, of course, kickstarting the vaccination process, specifically for the social development sector. Now, this morning, they arrived here at the Rabosutu Hall and they went on a walkabout, also speaking to those who have been affected and who will be obviously getting their jabs here today. Of course, this includes early childhood development. So this is the focus here for the Social Development Department. Going to bring in the Minister now. Minister, thank you so much for having this interview with us here on Newzroom Afrika. Today, of course, is a day for Social Development Department, especially looking at, the sector around ECD. Previously, they've complained, saying that they were originally left out. And this is something that they felt as if, they should have been prioritized when it came to the vaccination rollout. But when you look at what is happening today here and interacting with those in ECD, when you look at what's happening in ECD, Minister, are you satisfied with what you've seen so far?
Yes, I'm very satisfied with what I'm seeing so far. And I do really want to put the record straight here, that as the Department of Social Development in our entirety, as DSD and SASSA, as well as the National Development Agency, there is absolutely no way that we could have forgotten about the sector at all. Every department is responsible for the different sectors. So we were also responsible for our sector. And I also need to clarify the fact that in order for people to be able to come through for vaccination, there are other processes that were necessary to make sure that people are registered properly. As you know, we have ECDs that are registered. We have other ECDs that are not registered. But we are not saying the ones who are not registered must not come through. We are covering everybody. But also in our sector as DSD, it is not only it's not only them that we have to cater for, the early childhood development. We have to cater for all other social development service professionals because they are also the frontliners. So we have been working together with the Department of Health from the very beginning. And of course, the other issue is about the availability of the vaccines. So we needed to make sure that when we start with them, the vaccine is available. And as you can see now, they're doing the vaccine that you only get one dose and you don't have to come back again. And so I'm putting that record straight, really, that it must also be understood. It's the first time that we are finding ourselves with something called COVID-19. So it's not possible that we could have been extremely perfect in the preparations that we're doing, but we are guided by the Department of Health, we are guided by the government overall, but prioritizing our sector was also important for us. We did prioritize them. Maybe what might have not happened is to communicate with them and communicate on time what our plans were.
Now, Minister, when you're looking around here and specifically monitoring this vaccine side, what challenges have you picked up as the Social Development Department? You have said this is not only a focus on ECD, it's also on other sectors, and also the issue of registration also comes up. What challenges did you notice here today?
So far, we didn't see any challenges. I don't know, maybe later on or earlier on, but when we were getting the briefing, they clearly explained to us step by step. The ECD practitioners and professionals, social service practitioners, they have their own queue, which is the entire process, the entire value chain of what they need to do. They have their own line. On the other hand, you have community who are coming here. So we've gone through and spoken to some of the ECD practitioners who are here, the workers from SASSA who are also here, because by the way, the workers of SASSA is not only just the people who are sitting in the offices. It is also people who are security and other auxiliaries that need to be there, because they also need to be protected. We went inside there. The process is very smooth. From the people who are administering the vaccine themselves, to the process of registration and ensuring that they have gadgets which are able to see the ID number of the person and the telephone number. By the way, Tinaga says well versed of checking the cell phone number and the ID, because that's what we were doing for the 350. So we have a very good process inside there. It's very quiet. And what I liked was the fact that inside here there is a segregation. After having done the vaccination, people sit there for 15 minutes just as to make sure that they are fine. And if they are not fine, there's an emergency area where if anybody gets sick, then they can be taken to the emergency area.
One thing that the Basic Education Department has picked up on is that, especially in Gauteng, we're not seeing a lot of teachers are getting vaccinated. How has the response been from those in the Social Development Department?
I'm worried a bit here when I look at the queue, to be honest with you, because after everything that had been said, I would have expected that we'd find many of them here. But as you can see, the queue is very short of the ECD practitioners. But from a side of SASSA, NDA and the department, there's quite a number of them. We spoke to a few ECD practitioners. Some of them were saying, oh, we are very afraid. We don't know what's going to happen after the vaccine. This is the message we would like to send to them. They are frontline workers. The ECDs in particular are open. SASSA offices are open. NDA offices are open. So it is important for frontline workers to vaccinate themselves, firstly to protect themselves, because you are not going to be able to go and serve other people when you yourself are not fine. So the message we're sending to them is, please come out in your numbers. Obviously, there's a control here. Some are still standing outside because we've got to make sure that people still keep the distance. We've got to make sure that we protect ourselves. My message is very clear. All the provinces where the vaccination is going to be happening, we are calling all the practitioners, we are calling on all the ECD practitioners to please go and vaccinate, because there's an in-between. And so they really need to start as far as possible.
Thank you very much, Minister. I'm afraid I'm going to have to cut you there because of time. As you heard there, Xoli, just talking about those in the ECD sector, as well as, you know, the rest of the Social Development Department, also talking about a concern in terms of numbers, that she's not seeing, you know, the greater numbers that she would like to see. And you'd know that some people have also been skeptical of still getting the vaccines, especially when you look at the education department. But they are earmarking at least 240,000 of their employees to get vaccinated during this rollout.
Thank you very much for that update.